can we start? Thank you very much.
The operating theatre, a place of hope and fear.
You've been so brave. Rest your head back, sweetheart.
Some of these patients come in, they're really scared.
You're not okay, because I can see it in your face.
We're back in day surgery at the Queen Elizabeth Hospital.
Where's the Queen?
Where the theatres, beds and staff have been rigged with cameras.
We work wonders here.
We use humour in theatre.
So you win some more local anaesthetic.
Capturing familiar faces hard at work.
No karate in here today.
Bless her, look how little she is.
Love you.
Performing complex operations.
You never know what you're going to get. It's exciting and I absolutely love it.
Is he all right? Is he breathing?
And changing lives.
Stand clear, please.
Inside the operating theatre.
I've never had anyone who said they haven't enjoyed it.
We probably just need the oxygen out for this one. We get some funny comments sometimes from the patients too when they wake up, because obviously they're under anaesthetic. Hello there.
They wake up wanting to hug you and kiss you.
And take you on dates, and then they realise when they're fully awake what they said and apologise.
Take it back.
Yeah.
I changed my mind.
What, do you want me to hold your hand when she goes to make you feel okay? Yeah. All right then, we can do that.
Some people seem to sort of stay in the drunk sort of phase, don't they, when they come back?
I mean, we had one guy, didn't he? He just didn't want to wake up. He just wouldn't.
Yeah, no.
Couldn't get anything out of him for hours.
Well, they all say, did I say anything I shouldn't have said?
And even when they have, you go, no, not at all.
Of course not. Just get the list up.
How are you feeling? I get a lot of comments about my bust. Yeah. Some are quite rude.
Well, they are quite big.
Hello, Sally Taylor. I think I feel more concerned this time round than last time, which is odd because I had such a good experience the last time, about 12 years ago. But I don't know if I'm just more aware now and older and just think things through a bit more. What time do you think I'll get in then?
Should be soon.
Sally has come to day surgery with her partner, Ben Fox. He's facing an unusual situation.
You look like you've been up all night.
Normally, he works here as the lead anaesthetist.
At the moment, I'm feeling a little bit apprehensive. I suppose when you've got a loved one that's having an operation, it's always you're going to feel a little bit of anxiety. I think you can know too much if you've got the knowledge of what happens within the medical profession, and then you've got a loved one or a partner that's having something. You can think of worst-case scenarios. So I've already been through that a few times today. Once it's all done, see how you feel, but I can get some bits for you. Soft food, or if you just want a bucket. If you just want a bucket of fried chicken, we'll get you that.
Suck on some fried chicken. I've got to have all 4 wisdom teeth removed because there's not really enough space in my mouth for them, and I've been having a few issues over the last couple of years, really. Hi. Yes. Last summer, I was on antibiotics because I got various infections, and then, yeah, and they just kept coming back each time, and then I just feel awful, actually, because I felt quite ill with the infections. Cool.
Howell's just going to come and chat with you.
Lovely, thank you. People giggling. Yeah. Ben won't be doing my anaesthetic. I definitely know that he wouldn't want to. We had that conversation before about if we have babies and all that kind of stuff, if I had to have an epidural, anything like that. And he's always said anyone that close, I wouldn't want to be any part of.
With Ben off duty, Dr. Howell is the one putting Sally to sleep.
Hello.
Morning.
Yeah, about 12 years ago when I had a knee op. Yeah.
Anaesthesia is incredibly safe and operations are incredibly safe. However, complications can happen. There's risks always involved.
Cool. Okay.
Somebody close to you will have told you all about.
Yeah.
Great stuff.
Cool. Yeah, thank you. Thank you.
Sometimes when those risks happen, they can happen incredibly quickly and you need to be really on the ball to deal with them straight away.
Any jewellery?
Yeah, I can get rid of all that. Be in trouble if you lose that. Ben and I met in our local pub, actually, and it was through a friend of a friend. He comes every year, miles away.
I wasn't told it was a blind date, so I just turned up at a pub and then a friend said, oh, someone coming here because they really like you.
You definitely need to have a lay down. Ben was doing November at the time and it wasn't amazing. It wasn't the best introduction in the world. His face was just covered in a big moustache. Dribbled on yourself again. You do.
I was a bit kind of stunned. So I'm normally quite socially awkward, and I was more socially awkward in this circumstance. But when I saw her, it was kind of love at first sight, and I knew that she was the one. So I proposed to her 4 months ago, and she said yes. And we went down to the beach. We took the dogs for a walk, and we were watching the seals and in the background. I think it was quite romantic.
Honey, that engagement ring better be tight on that finger. Is it? No.
Okay, I'll put it in my wallet.
Up top left.
Yeah, last one.
Oral surgeon Mr. Haddock will remove Sally's wisdom teeth.
Hello.
I had no idea. At all. You happy with me doing this?
Yeah.
Great. Hi, my name's Alan. Ben's probably told you all about me. I'm going to do your wisdom teeth today. You may have a bit of hamster look afterwards.
Great.
But it goes away. It goes away quite quickly. There's always the risk of numbness to the lip and tongue. Sometimes people dribble, so an old towel on top of the pillowcase. Poor Ben's got to wash these things. So, okay.
Great.
Right.
Yeah, see you soon. Ben is so kind. He's just very, very calm and a really warm. I told him to stay at home, actually, and I'd be fine. He can just pick me up, but he's here, and he's going to be in the waiting room for me. Right. This is Ben's dressing gown. Right, see you. Bye.
Just like to go through.
Hello. Hi.
Yeah.
Lovely.
There we go.
Yep.
So what are we keeping you from today?
Work.
What do you do?
I've got a music school in Norwich and in Kings Lynn. Yeah, so I do a bit of the singing tutoring.
So this is just a bit of oxygen. I'm just going to hold this over your face gently.
Okay, so we're just going to start to drift you off to sleep, all right? You must sometimes feels a little bit cold and achy as it runs up your arm. That's nothing to worry about, all right?
I think when Sally wakes up from her operation, she's a wonderful drunk, so she'll probably be kind of quite lovely and warm and friendly to everyone in recovery room and telling them how much she loves them.
Ooh. I feel like I've had too many glasses of wine and
There we go. It's good stuff, isn't it?
Okay, yeah.
All the benefits with none of the hangover. Nice deep breaths. All right. That's it. Well done. Sally, just open your eyes again for me. Looks good. Okay.
Mr. Preston, come on in. Are you all right?
Thank you.
Wash your hands with this, please. Thank you.
I'm a bit nervous. I must admit I'm a bit nervous, you know. But when it's painful, you can't really do very much, you know, because you're doubled up.
All right by the window, Brian. Look at that.
You take a seat here.
I can sit there, thank you.
It is very debilitating when you have the same pain and it's for 2 or 3 days.
Staff nurse Bai is looking after Brian on the ward.
Okay, these are the stockings. Okay, if you have any problems putting them on, let me know. If you could put it on now, that'll be fine.
Are they like up to the knee or?
Up to the knee, yeah.
Up to the knee,
Yeah.
all right. You're going to look glamorous now.
Pat brought me here, my young lady, and she is young. She's 5 years, 5 years younger than me.
They're so tight.
Rachel, come in my office.
I'll have to help you otherwise.
Well, my wife died in the June, and Pat's husband died in the November of the same year. So me and Pat got together, and, well, one thing led to another, and I fell in love. Is that right?
Oh, they don't look too bad, do they? Brian and I have known each other for more than 40 years, and he's my partner now. We've been together for just over a year. Nice fit.
It's
like
sexy.
Actually, they're quite nice. They go nice with your shorts. I'm a bit nervous for him, but I know that they'll take good care of him. He's got a double hernia, both sides. He's really happy that he's getting them done so he can get his life back to normal.
Mr Batty is Brian's surgeon.
Hello. Hi. Good morning. How are you?
Very well,
Sorry,
thank you.
I actually need to just examine you. Make sure just which hernia is bigger, because if the hernia is very large and it's going into the scrotum, we may not be able to repair it keyhole. It's not the best. So I just need to have a look at it. Is that okay?
Yeah.
Fine. So this, although this is bigger, isn't it? And this one. Can I ask you to lie down? Is that okay?
Yeah. I was polishing the motorhome, I overstretched and I gave myself an hernia. So, and the second one, I think that come on, I think that was playing golf.
Just trying to feel for your testicles, okay? Sorry about that. You've got a large hernias. So we should be, and they're reducible, so you should be able to repair it keyhole. If, for example, we are not able to repair keyhole, then we usually do one at a time, which is the best way forward. So once you recover from that, then we bring you back to do the other side.
Prefer them both to be done at the same time if you can.
Yeah, of course, that's the idea.
Might not have the courage to come back the second time.
See you later. Okay, thank you.
The one on the left side I've had for 8 years, and the one on the right side I've had about 18 months now. Yeah.
See you later.
Right, mate.
And I hope all goes well.
I'll be all right. I just hope he does the two. The one on the right side that is causing me all the pain at the moment. The other one's so big now, it's like an old friend. I'm going to miss it when it's gone.
Oral surgeon Mr Haddock performs up to 5 operations a day.
See Richard speaking. He is indeed. Oh, no.
But it's not always the surgery that's the biggest challenge.
That was Jill. My Jill. She's got a puncture at the side of the road. She's got a couple of heroes there already, but they can't get the wheel off. Can you give her a ring when you're finished doing what you're doing?
Thank you. Just to add pressure to this procedure, yeah? Too busy taking out teeth.
Fancy a little wander?
Mr Haddock is going to operate on singing teacher Sally Taylor, who needs 4 wisdom teeth removed.
No prophylaxis required, no hair removal, no critical steps to be reminded of, and we can go. Thank you.
Her fiancé Ben works as the head anaesthetist on the unit. Today, he's waiting on the ward.
This operation will have a beneficial effect on Sally's life because she was getting recurrent tooth infections, which are incredibly painful and were affecting her quality of life and also her work.
Wisdom teeth are the last teeth to come through. There's 4 of them, 1 in each quadrant, and occasionally when there's not enough room for the wisdom teeth to come in, they grow in at an angle and become impacted. Okay. Get some light on this subject. The problem with Sally's teeth were that they were stuck against the tooth in front of it, and beneath the gum she was getting recurrent infections. That can't be much fun, it causes misery, and it's painful. Okay, suction. Straight body, James, please.
Mr Haddock begins by rocking the tooth backwards and forwards to widen the socket.
Just see if you get any movement, which we always will. Is it enough? Here we go. Okay. Okay, so that's fine. Gonna give it a clean out and a wash.
He then repeats the process on Sally's upper jaw.
So all you want is just a little bit of movement and then keep following it round. Okay, so if you get forceps in that, it will always break. So you do it gentle. Right, so.
With 2 teeth extracted, Mr Haddock works on the other side of Sally's mouth.
Okay, so you get curved roots, but it comes out easier that way because it's more erupted. So it just comes out that way. Okay, that looks nice and clean. This is a big tooth. You can do it nice and slow. Really, really slow. You want to remove it whole. When any tooth breaks, including a wisdom tooth, it can't make it more difficult because there's less of a tooth to get hold of. That is a big tooth for a young lady. Okay, so it's holding it up. Okay, big tooth, big roots. Okay, can I have a stitch, please? Thanks.
What I've done today is completely separated myself from my profession and what I'm actually here to do, which is to support Sally.
Okay, we're finishing up, thank you.
Sally, just open your mouth, my love. Just open your mouth and stick your tongue out. Hello.
All done.
Done.
You're just waking up. You've had your operation. It's all good. It's all done. It's all finished. You're just in recovery. Relax. Chill. Operation's all done.
Hiya, you alright?
are you?
All right.
Oh, you look very healthy.
Thank
When's this
you.
baby due?
2nd of January.
Oh, I
Yeah.
say. So you're going to have a late Christmas present.
Yeah, well, might be early yet. We never know.
Oh, there you go.
What is your name, please, ma'am?
Joyce Roberts.
Lovely. They'll be with you as soon as they can.
Okay.
All right.
Yes. I live in a little village about 5 miles from King's Lynn, and my date of birth is 1931, which makes me quite an old lady.
Joyce Roberts, please. Mrs. Roberts, hello. Would you like to come through? Are you right? Do you need a hand?
No, it'd be fine,
right,
thank you.
okey-dokey.
I have to take the time, I'm
That's,
afraid.
yeah, you're all right. Don't rush. No, you're fine. You're fine.
I am a widow. My husband died in 2010, and we'd been married for 53 years, 53 lovely years. I miss him dreadfully, of course, but there we are. Life has to go on. I'll sit in the comfy one.
That's
shall I?
absolutely. That's it. That's it. You'll be here longer than me. So
Okay.
you better have the comfy one.
Yes. I have to have a cataract operation on my right eye.
So I'll just pop your drops in so they can start working.
Not the sort of thing that you have done every day of the week, is it?
You get several rounds of drops, so I'll come back and top you up several times. This is your first round. If you just look up for me. Well done. So a tiny bit stingy. Sorry, that's it. That's got you.
Joyce has had glaucoma, a deteriorating eye condition, for over 10 years.
Have you got to have your other one done as well at some point, have they said, or is it just this
Yeah,
one?
but that, Mr Batty hasn't mentioned that.
No,
Not
fair
yet,
enough.
anyway.
No, okay, one at a time. One at a time, fair enough.
Yeah.
Her eyesight has got so bad, she now needs surgery.
There's nothing to worry about, is there?
You'll be fine. You'll only be in there sort of 20 minutes. It's the waiting that takes the time, really.
Yeah,
when
I'm
you
not
get in
worrying
there.
about that. You know, there's people that are far worse off than myself, and it's the attitude that you have to take. A lot of people don't think like that, do they?
No, not always.
I hope, you know, that everything will be, you know, tickety-boo, and that it will enable me to, you know, lead a better life.
Okay, we have now the third patient on the list, Joyce Roberts. She's an 86-year-old lady. Now, she's got a cataract in the right eye.
Consultant ophthalmologist Mr Saeed will perform the surgery. Mr Gunda will assist and has come to talk it through with Joyce.
Hello. Nice to meet you. How are you?
Mr. Kunda. Yeah.
Nice to meet you.
So, you know what we are going to do today?
Yes, you're going to put me yes, correct the eyes on.
So take out the cataract and put a new lens.
Right.
Yeah?
Yeah.
Any questions from your side?
No, I'm in your capable hands.
So if you're okay with it, need the other eye to be done within few weeks. Is that okay with you?
The other eye?
Yeah.
Really?
Yeah, because when we choose a lens today,
Yeah.
you will not need strong glasses,
You
but you
won't?
will need strong glasses in the other eye.
Right.
So that will cause double vision.
Okay, right.
So you might have to do the other eye in few weeks.
Right, okay.
Is that
Yeah,
okay
that's
with you?
fine.
Yeah,
I do get a bit sort of anxious and fraught or whatever, you know, when you know that you're getting on and you've got arthritis in your right hip and you seem to be jumping from crisis to crisis. But you have to get on. If you stop, you're just going to exist and not enjoy life.
So just going to put a mark on your forehead here, here, and there.
Mm-hmm.
Any questions, Joyce?
Nothing to worry about, is there?
Nothing to worry.
No.
We'll see you soon in the theatre.
Okay,
Yeah?
yes, thank you.
Sally Taylor has just had surgery to remove her wisdom teeth.
I definitely had a lovely sleep.
Get you to open your mouth and I'm going to get these packs out.
Okay.
That's lovely.
Oh, that's lovely.
Is that better? You're a bit more normal now.
Yeah.
Your cheeks are half the size
Yeah.
now.
That went fine. We put some stitches up there, one down there. They all come out well. You get big teeth for a small girl.
Maybe it might rein in my chewing bands era.
You're still going to get married.
Well, Ben might change his mind after looking at my
After 2 days, he'll be madly in love with you again. Well, all men are fickle.
He's not fickle, Ben's not fickle.
Right there, Sally, we'll take you back now. Hopefully Ben's waiting for you.
Hopefully.
He might be asleep. He's really tired. Hey.
There she is. Well, we've all been invited to your wedding, Ben.
Yes,
so
we Thank
Have a lovely
you.
recovery.
Thanks
All
so
right.
much.
See you later.
Bye.
Hey.
Hey.
How are you doing?
Good.
How are you feeling? You cold?
I don't know if it's cold or what it is. Just shaky. Yeah. Thank you. It's a bit sore.
Yeah.
That hurt more than I remember. You were going such a wuss. I feel like going back to sleep.
Have a sleep, Joyce.
If I have a sleep, I'll be here for hours. Let's get home and have a sleep.
Hi, Cal.
Hi, Christopher.
How
How
are you?
are you?
Are you feeling better?
I am, thank you. I've just buffed in bay 4,
Lovely.
so please don't
All
ruin it
nice.
this afternoon.
We'll tell them they can only be admitted with white trainers.
Your bay did not look very pretty. It's going to take a couple of going over to make it actually look
You always do a brilliant job.
Thanks, my love.
Okay, love
Bye,
you. See you
bye.
later.
Bye. Shall we go? Get this done.
Okay.
If we must.
You come all this way, you might as well.
Yeah.
Brian Preston is in hospital to have a double hernia operation.
I'll have to wear Speedos underneath my swimming shorts. Because if I just wear the shorts, then I'd get the pain.
Hi there.
Hello.
This is Brian. May I take your dressing gown and your slippers, please?
Pat don't like me just wearing Speedos. I'm 73.
What are you going to dream about when you go off to sleep? Somewhere nice and exotic? Somewhere for
Perfect golf
holiday?
course.
Oh yeah, what's your, is it handicap for your golf?
You okay there?
Well, hopefully they're going to be able to do the 2 hernias together. Although he's nervous today, he's really pleased he's come so that he can actually get rid of them.
Brian's surgeon, Mr Batty, will perform the operation using keyhole surgery, but he may have to open him up.
I'll do that side first. That's smaller and okay. Can I have the knife, please? Gas on, light on.
Brian's abdomen is inflated with carbon dioxide to create space to work in.
Okay, so let's just get the scope in there.
A telescopic camera is put through a port inserted through Brian's belly button.
So now we can secure this. That's a big one. Whoa. Brian had 2 large hernias. A double hernia means more time to perform the procedure. So that does have the longer anesthetic time with its associated risks. The associated risk of forming a clot in the legs, which can travel to the lungs, the risk of infection, it all increases. Yeah, so there you are. So you just retrieve the bowel from the hernia. It's a big bowel, isn't it? Thank you so much for that. So that's the hernia there. Yeah. Can I have the mesh now, please?
Mesh is inserted to strengthen the stomach wall and to stop the bowel coming back through.
So let's have a look now. Yeah, that's better. Yeah, so that's okay now. So that's good. Can I see here? It's all covered? Yeah? Happy? Okay, fine. Let's start the other side. Oh, I need to go on that side, isn't it? Okay, I'm gonna come on that side.
The second hernia is larger, so will be more difficult.
This is really going to be a bit tricky here because of this inflammation. Can I just see outside? Very strange, isn't it?
With the hernia inflamed and close to the scrotum, the surgery is proving more challenging.
So this is right next to the pubic bone, this hernia is. Okay, let's have a look here now. Oh, I've made a hole. In the peritoneum. Let's see where the hole is.
There.
Can I have another loop, please? I think that should be okay. Okay, can we have the mesh, please? There is light at the end of the tunnel.
The operation has taken 2 hours.
See, that's perfect. That's very good. Lights on, please.
Okay, everybody ready? On 3. 1, 2, 3.
Hello there, just in recovery. Just going to pop a mask on just to give you a bit of fresh air. You okay there, Brian? You're in recovery, Brian. It's all done. Just lie still, Brian, just because you're a bit wobbly at the moment. Yep.
Had a lovely dream now, and you spotted.
Sorry about that. It's probably just getting good when we woke you up, was it?
Oh, I didn't give away no secrets.
It's just your bank account number and your PIN number and all that sort of stuff.
That's good, because you can remember what it is.
Feeling okay?
Fine.
Yeah, good.
You got both done.
Yeah, both done. Any pain anywhere? You okay? Comfortable, isn't it?
Yeah.
Comfortable, that's very
There's
good.
a little bit of tummy.
Yeah, that's fine. Okay.
That's only to be expected.
So, no heavy lifting for about 6 weeks. There were big hernias. Obviously, you know, bowel was coming through and everything. And I shall see you in my clinic in about 3 months, just to make sure everything is okay.
Yeah.
All right?
And,
okay, I'll see you later.
Thanks very much.
Thank you.
Thank you.
Lovely. Thank you.
Good afternoon.
You all right? Are you all right?
Yeah.
You've had both done then?
Yeah. Yeah.
Good. Good. You feel drowsy?
I could go to sleep on a sixpence.
He's looking forward to getting back to wearing his boxer shorts that he prefers to wear. Oh gosh, I hope my daughter's not listening.
3 hours after his surgery, and Brian is almost ready to be discharged by Nurse Lynn.
So everything looks all right, you know,
yeah.
observation-wise.
It's just like a stomachache now.
Okay, well,
Probably lack of food.
Could be. The gas that they use to inflate your stomach to do the
It's going to come out
operation.
later.
Well, yeah. How long have you been together then? A while?
Well, both our partners died in 2016.
Oh, right.
And then...
I fell in love.
Dear.
Well, I'll be able to wear just shorts instead of 2 pair of swimming trunks. Yeah, I might just wear the Speedos just to upset Pat.
Hello, Mr. Roberts. How are you today?
I'm not so bad, thank you very
Excellent.
much.
Okay,
Nice
good to see
meet
you. Please.
Yes, thank you.
86-year-old Joyce Roberts is about to have essential eye surgery.
Thank you very much.
So we're going to do your right eye operation to take out the cataract and put a lens implant, and that should improve your vision. Do you have any questions at all?
No, I'm a bit nervous.
Okay, you'll be absolutely fine. Okay, it wouldn't take long at all, just 10 minutes.
Thank you. I am feeling nervous. I understand that they're going to freeze part of my eye. I'm not absolutely sure about this. I did read up on the details, but I don't tend to take too much in. Maybe because I'm getting a little bit, you know, sort of nervous.
Are you comfortable?
Yes, thanks.
Good.
Lead consultant Mr. Saeed will be mentoring surgeon Mr. Gunda during the tricky operation.
Just going to give you a little injection, you all right? Just to numb the eye. This procedure is normally done under eye drops only. We numb the eye surface. But since Joyce is feeling pain, we're going to give an injection.
Yeah, we'll go into it, right? You'll feel a bit of pressure, Joyce.
Just a little.
Yeah.
Now that was the worst part of the procedure. The rest is going to be easy for you, all right?
You keep squeezing my hands. Are you okay? Yeah? Good.
Microscope. Yeah. So that's what you can see. That's a cataract.
What appears on the microscope as a big structure, this lens, cataract, is smaller than the size of a Smartie.
Inside the pupil, you can see the lens, which is a bit cloudy. So today's procedure is to take out that cloudy lens and put a new lens in its position.
In ophthalmic surgery, you need 2 eyes, 2 hands, and 2 feet working together. Expert assistance is paramount to this surgery because I cannot take my eye off the eye. All this time it's done under a microscope. So Jane is my assistant who knows what instruments to hand over to me and at what time. And I don't have to lose my attention. So what I've done is cracked the lens cataract into 2 halves.
The next step is to make small pieces of the remaining 2 big fragments and then suck them out. Looks like a bit of hard cataract. I mean, quite dense cataract.
Must have taken a long time to grow to this density and size.
With the cataract removed, Mr. Saeed can insert the new artificial lens.
So it's called a foldable lens. The size of the incision is approximately 2 millimeters. You can see the lens going in. It sits snugly in the open bag.
And it's got these little 2 loops. They open up and keep the lens in position. I have to say this particular operation today has taken slightly longer than it would take otherwise. Operation over, and we remove the clip.
That was a successful surgery.
Well done.
Joyce's surgery has taken 25 minutes.
I hope it wasn't too bad for you.
No. I get more concerned about my arthritis in the hip.
Okay.
Anyway, thank you
Fantastic.
very
All
much
went
indeed.
fine. And good, excellent. We'll take
Thank
you
you
back to the
very
ward
much
shortly.
indeed.
Thanks, Hannah.
Okay, thank you, everybody.
Yeah, you're well done.
I need to sit up.
Yes, I'm going to sit you up now.
My next door neighbour, when she heard that I was going to have an operation done, she said, "You've got the best."
Oh, I'm glad to hear that.
Yes.
Okay.
So thank you all very
You're
much.
welcome.
Thank you. Bye-bye, my dears. Bye-bye. Thank you very much.
Well done, then.
Oh, thank you very much.
Bye.
God bless. Bye-bye.
Just 10 minutes after the operation, and Joyce is ready to be discharged.
I'm feeling great and relieved. It's wonderful. I mean, I'm very fortunate, aren't I? Look here, 86, and they've done an operation on my eye, and they said that they want to have me back in a few weeks' time to do the other one. I'm feeling on top of the world.
She's only me.
Oh, bless your heart.
Joyce's friend Sarah has come to take her home.
How are you?
Yeah, it was a bit more longer than they anticipated because the cataract apparently was a bit more thicker. Yeah. But, I mean, honestly, you can't fault it.
Anyway,
You know, but anyway,
Mrs.
yeah,
Roberts.
let's go. Yeah.
Brian's operation repaired both his hernias, and he and Pat are back to enjoying an active life together. Joyce's surgery has corrected the vision in her right eye.
Bye-bye, darling.
She's now waiting for surgery in the other one. And Sally's operation to remove 4 wisdom teeth was a complete success.
Let's go home.
Let's go home.
Yeah.
She and Ben have set a date for the wedding and found out they're expecting a baby.